One of the commonest problems nowadays that I see, especially in my geriatric patient group, is patients complaining of back pain, body pain, inability to carry out day-to-day exercises, etc. And this is because of what we call as osteoporosis. This is more common among women. I am Dr. Harshavardhan Hegde, Senior Director, working in the MAX group of hospitals, Saket, in the Department of Orthopaedics. The WHO has classified this into three groups where there are normal, osteopenia, or osteoporosis. Osteoporosis develops especially in women at a slightly earlier age because of the onset of menopause. Lack of exercises, smoking, poor control of diabetes all adds to the problem. Now, during menopause, the sudden fall in the level of estrogen increases the chances of osteoporosis. This can be, to some extent, taken care of by regular exercises, proper diet, control of diabetes, which is properly done, and to give up smoking. If these things are taken into account, exposure to sunlight included, then of course osteoporosis well managed. In the event the DEXA scan shows some osteopenia or osteoporosis, we may have to add calcium to the diet, we may have to add vitamin D to the diet in case you're low, and in some cases we'll have to use medication which helps the bone to form, like bisphosphonates, denosumab, or even teriparatide. Now this depends upon the extent of osteoporosis. With this brief background and an importance of exercises, osteoporosis can be managed to a great extent. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.